Good afternoon, everybody. Thank you so much for joining us for The Scope, a special edition of The Scope podcast. My name is Paige Heitman, and I'm your host for today's webinar. Today, we're going to touch on a couple of housekeeping items before we get started. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating the session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you out if you need it. Just feel free to ask. Also, we would love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please go ahead and turn on your video. Please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get that question answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person. We would encourage you to send your question or comments to the whole group so that everybody can participate in the discussion. However, you're also welcome to send a private question or comment if you feel more comfortable doing that. We want to encourage everybody to utilize the reactions that Zoom offers during this discussion today. You can use a thumb clap, or a hand clap, thumbs up, thumbs down, etc., to let us know if you like, love, agree, or disagree with whatever we're discussing today. Reactions can be found in two places, one either at the top or bottom of your screen, and one you will see when you display the participant list. Also, if you're watching from our Facebook live stream, feel free to ask questions, comment, or show us emoticons during our conversation. We will be conducting a few polls throughout this Zoom meeting, so you'll get a chance to interact then if you choose. And of course, remember the chat feature. All of our polls that we're going to be conducting today, all of those are anonymous as well. Some of you may be using a mobile device, while others of you are using a laptop or a computer. If you find that your features aren't the same, we just ask that you participate with us in any way that you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. So before we dive in, I want to give a quick introduction for our Scope at Lunch guest today. Dr. Erik AuBuchon is an internal medicine physician and medical director of health informatics at Phelps Health. Hi, Dr. AuBuchon. Go ahead and wave for everybody. Perfect. So before we get started, we're going to go ahead and pop up a polling question for everybody. How comfortable do you feel caring for yourself or a loved one if you were to get COVID-19? I'll give everybody about 20 seconds to go ahead and answer this question for us. Got about 5 seconds left. All right, I'm going to go ahead and end the polling and share those results. So it looks like we have a mix of things. We have 40% of people who are either a little uncomfortable or not comfortable at all, which is really great. We're glad to have you as part of our conversation today. And we also have some people who are pretty comfortable or just really comfortable, and maybe they've had this experience before. And we're also really glad that you're part of our conversation today, and we'd be happy to hear your experience throughout this conversation. And we're going to go ahead and dive right in. So Dr. AuBuchon, this first question, what does supportive care or supportive therapy even mean? Oh, and it looks like you're muted or we can't hear you. Sorry. You may have to call in. I apologize for this, everybody. Just hang in with us. Do you want to try talking now, Dr. AuBuchon? I think I can hear you. Dr. AuBuchon, I can hear you now.
Can you hear me now?
Yes, yeah, we gotcha. So we're going to go ahead and dive in with question one. Great way to start is with some technical errors, right?
I know, exactly.
So now that we've got that out of the way, let's go ahead and dive in. What does supportive care or supportive therapy mean?
Sure, thanks for having me. Yeah, so that is funny that the medical director of health informatics is struggling with technology, but that just shows that I'm just that much more accessible. So the term supportive treatment, supportive therapy are kind of general terms that mean different things that one can do to kind of help with symptoms caused by an illness. They can range from hospital measures such as supporting breathing with oxygen and other devices. They can mean IV hydration with fluids, but they can also include things that we can do at home to relieve some of the more common symptoms that can be associated with illnesses, and in particular COVID-19.
Great. So moving on to question 2, what are some of the symptoms of COVID-19 that we should watch out for? And as a sub question to that, what are some of the symptoms that seem to be more prevalent with COVID-19?
Sure. So that's a really good question because from the beginning of this pandemic to now, we've learned a lot about COVID-19 and how it presents. So there are a lot of possible symptoms of COVID-19 that we now know of, and the big problem with it is that a lot of these symptoms can be caused by other common illnesses or issues. So some of the more common ones, because this is a primary respiratory issue. Um, you will have things such as fever, chills, cough, some shortness of breath or difficulty breathing. A common one that you hear of a lot, at least on in the news, is loss of sense or of taste or smell. So those are, not as surprising because we're talking about a respiratory illness. But some of the more general symptoms: fatigue, body aches, headache, sore throat, congestion. Those are much less specific, and they can be a little bit difficult because other things that are happening this type of time of year, like seasonal flu, common cold, strep throat, all of those can cause some of these symptoms as well. So it makes it difficult. And another little added addition that we have seen now is that some people with COVID-19 can actually have no respiratory symptoms and only have gastrointestinal symptoms like nausea, vomiting, or even diarrhea. So I would say the most common symptoms are probably some of the more common ones I discussed earlier, like fever, chills, cough, congestion. But as you can see, there's a wide range of symptoms that you can have with COVID.
Yeah, absolutely. We had a question come through on Facebook that I think is relevant to what you just spoke on. When will taste and smell return once somebody has COVID-19 and they've recovered? Is there a time frame on that, or is it different for every person?
So that's a good question too. Unfortunately, we don't have a good answer yet for that. The majority of people who have this issue with loss of a sense of taste or smell usually recover that relatively soon after they've kind of gotten over the illness. But I have had cases of patients who've had persistent symptoms with this last weeks or even months. And I even had a few cases of patients who may have gotten COVID, September, October of last year, that still don't have their normal sense of smell or taste. So it's really hard to predict. We do know that the majority of people do recover, but it's really tough, especially since it's obviously very important senses that we use. So hopefully soon we'll be able to learn more about who's going to have this symptom and how long it'll last.
Great, thank you. Question 3. Once a positive COVID-19 diagnosis is made, what should somebody do? What are the steps they should take?
Sure. So, obviously, if you've been diagnosed with COVID-19, most of the time that's in context of having symptoms. So, if you've been diagnosed with COVID-19, the instructions that you'll typically get involve making sure that you do isolation measures to try to help prevent others around you from being ill. But from a personal standpoint, what you should do, you want to be able to monitor your symptoms. Specifically, you want to be looking for any major signs of illness, like significant trouble breathing, chest pain or pressure, feeling shortness of breath on just minimal exertion. If you usually can walk up a flight of stairs without problem, and just taking a couple gets you short of breath, that would be concerning. Difficulty with neurologic issues like getting confused or hard to stay awake. Those are all things that we would want to know as soon as possible so that we can help get you more significant treatment, but including an evaluation by a medical professional. But the first steps are getting isolated and then being able to kind of keep track of what your symptoms are to look out for more concerning symptoms.
Great. So, a follow up question to that is you mentioned being confused and having those neurological problems. Can you
Mhm.
talk about the difference between just having brain fog with COVID-19 and being confused to the point where you need to seek medical treatment?
Sure, it's really hard to differentiate if it's kind of mild symptoms because everybody or a lot of people when they get this, you're going to feel fatigued. You're going to feel like you're just not as sharp as you normally would. Confusion or difficulty with just even being able to stay awake. Those would be more prevalent, and it would be things that are kind of beyond just the regular brain fog where maybe and it's mostly going to be detected by others around you and not necessarily yourself, but family members are saying, wow, you're forgetting that we just had this conversation, or you're forgetting things that you don't normally forget. Then that would be a definite trigger to be evaluated. And if you're not sure, then there's nothing wrong with talking to your primary care provider and getting more information and describing that what's going on with them, since they know you really well from a health standpoint. It can help hopefully triage you in the right direction.
Great. Thank you so much. So, we are going to go ahead and move on to question 4. This one's a little bit lengthy. How can a person know if they will have little to no reaction, a mild to moderate reaction, or a severe reaction once they've been diagnosed with COVID-19?
Yeah, so this is unfortunately we haven't found a way to know at the time of diagnosis how severe of a case someone is going to have. Luckily, most patients will have minimal to no symptoms, which is great. But there is a proportion of people that will have more significant symptoms that can last for some time. So these are people that are kind of sick from the start, and they may peak with their symptoms when it comes to breathing, coughing, fever, and then they start to improve, but maybe over a slower time frame. And then there's an even smaller proportion of people that's even more important to recognize that they may feel fine at diagnosis, or they have minimal symptoms and they're doing okay, but then after even as long as 7 to 14 days start to develop more significant symptoms. And that's not something that's expected, because usually you think you get an illness, you're going to have it, and then you're going to get better and everything's going to be fine. But with this, there's some unpredictability when it comes to that, as we've seen some patients who are doing just fine at diagnosis. They're able to take care of themselves at home. They start to get better. And then day 7, day 10, day 14, they really start having significant breathing issues or oxygen issues. And I've even had patients that come in the hospital after having been feeling fine, but then develop symptoms later on.
So, a follow up question to that for people who have varying levels of reactions, what suggestions of like hydration and nutrition are recommended for people who like can't taste or smell? Because that's a pretty important one, like you mentioned. If there's like a fire or a gas leak, obviously those are really important, noticeable things. So, when there's a lack of taste or smell, obviously there's no intake, right?
Mhm. Right. So especially for patients who are at risk for other reasons when it comes to nutrition, some of our patients age 65 or older, or maybe even our younger patients that just have significant chronic medical conditions. Nutrition is extremely important for a lot of reasons, but nutrition and hydration can be more difficult if you are not able to, have your sense of taste or smell. So in that kind of realm, it becomes more of a job than anything to just make sure that without those senses, you have to have some way of triggering you to make sure that you're getting enough in from a fluid standpoint and from a nutrition standpoint. So a lot of times that means that you involve your family or your support system, making sure that they kind of stay on you to make sure that you're getting hydration and you're eating appropriately, and then just being aware of those who are around you, aware that you have this issue, so that way if something were to happen in the home or somewhere where if there's some sort of incident that you would depend on those senses, that they are aware, so that they are able to assist you whenever they normally wouldn't have to do that.
Perfect. Thanks so much. We're going to go ahead and move on to question 5. How is the coronavirus treated at home? And you kind of mentioned on a couple of those things with diet and nutrition, but what are some other supplemental treatments or supportive
Mhm.
care?
Sure. So the mainstay of treatment at home is very similar to other common illnesses, such as the flu or cold. Um, Maintaining hydration is extremely important. You need to have good fluid status to be able to, fight off the infection, to be able to maintain your immune system. So you want to make sure that you're hydrating well, and that if you're not able to, that you're able to have access to your primary care provider to help with that. Making sure that you're getting plenty of rest. Most people aren't going to want to get out and do a whole lot of activity if you're not feeling well, but it is important to make sure that you are resting and that you are, even if you're moving around, which is encouraged as well, that you take frequent breaks and that you're getting plenty of rest. You will want to do things like monitor your temperature. So, a big myth is that a fever is bad. A fever is not necessarily bad. It's your body, trying to, change the environment of your body to make it less comfortable for an infection. So that means raising your body temperature. We really worry whenever the temperature gets really high and stays high. If your temperature is going above 103 and it's not coming down with typical over-the-counter medications, then that is something that we would want to make sure that we know about. But um, at the end of the day, whenever you get a fever, you also just feel really crummy. So using over-the-counter medication that you're safe to take for the aches and pains as well as the fever are important. And then just recognizing, as we mentioned before, what are those red flag concerning symptoms that if they happen, we need to make sure we're talking with our primary care provider. Just keeping an eye out for those.
Great. Thanks, Dr. AuBuchon. So before we move into our next polling question, I have one more question for you. Can somebody get pneumonia from COVID?
Yeah, so that's a really good question. So since pneumonia itself is basically an inflammation of lung tissue, and COVID-19 can affect the lungs, it's very possible to get pneumonia due to COVID-19. So if that's the case, then these patients would typically have more severe symptoms, including a persistently high fever, difficulty breathing, low oxygen levels, things like that. Unfortunately, this pneumonia is caused by the COVID-19 virus, and so it's different than a bacterial pneumonia, which can happen this time of year, and which is something that we get vaccines for. The mainstay of therapy for that type of pneumonia is antibiotics. Unfortunately, if you get pneumonia due to COVID-19, antibiotics aren't as effective. So you can get pneumonia from COVID-19, and it can cause all those symptoms as above.
Great. Thank you. So we are going to move into another polling question and then we'll continue on. Let me go ahead and pop that up. Do you know your risk level for COVID-19? I'll give everybody about 20 seconds to answer that question. Got about 10 seconds left. And I'm going to go ahead and end the poll and share those results. So we've got 36% of people that don't necessarily know their risk level for COVID-19, 64% of people that are pretty comfortable with understanding what their risk level is. So this is a great poll to take us into our next question, which is what are the different risk levels by age for contracting COVID-19?
Yeah, so this is a good question. It's something that I get asked a lot. The risk of actually contracting COVID-19, I would say, is pretty similar across all age groups, but the thing that we worry most about is the risk of developing severe illness from COVID-19, and that can vary by age and other medical conditions. So we know that typically children have less severe illness as a whole. But that doesn't mean that all of them have that same risk. Babies that are younger than a year old, or any child or adolescent that have chronic medical conditions such as asthma, chronic heart disease, any kind of metabolic disease, anything that they are monitored regularly for, all of those, everybody in that category would have a higher risk for getting severe illness. The same goes for people aged 19 to 64. If you're otherwise healthy, the risk is a lower, it's not zero, but it's lower for severe illness. But if you have chronic medical conditions, like those I mentioned before, other chronic conditions, chronic kidney disease, liver disease, et cetera, that does put you at higher risk. And of course, we know that anybody age 65 or older, they are at higher risk of getting severe illness, even if they don't have any other chronic medical conditions. And we don't have a good explanation for the reasoning why there's different levels of severe illness risk, but that's just what we're seeing with what we've seen now over the past year, plus with coronavirus.
Great. We're going to go ahead and move on to question 7. Is there a medicine to take for COVID-19 that can help with symptoms?
Yeah, so as I mentioned earlier, some of the medicines that people usually take are the same medicines you take for regular illnesses elsewise, like a cold and flu. But there are specific to COVID-19, there are medications that have been approved that are special medicines that are given by IV that can be used for patients who get COVID-19 and have a very high risk of severe illness. So this is something that if you contract COVID-19 and you have you're over age 65, you have other chronic medical conditions, it's something that your primary care provider might try to get you treatment for this. It's something that's done. You don't have to stay in the hospital for. It's just a medicine that you get through the IV in the hospital and go home. And of course, it's in limited supply. But that is a typical treatment that someone could get who may not be sick enough to be in the hospital, but has a really high chance of getting very sick with it.
Great. So to kind of supplement that, what about pain relievers? Are there any pain relievers that can safely be used for COVID-19?
Hmm. Yeah, so as you probably know, we mentioned that typically you'll have symptoms of body aches, muscle aches, headaches, sore throat. So you've got a lot of potential ways to be in pain with this. Typically, we recommend acetaminophen or Tylenol as first line for aches and pains, for fever. Usually that's pretty adequate for treatment, and you just want to follow the dosing given to you by your primary care provider or what's on the bottle. And unless your primary care provider or other specialist has told you to avoid non-steroidal anti-inflammatories, such as ibuprofen, naproxen, Motrin, Aleve, unless they've told you to avoid it for some other reason, you could consider using this if Tylenol or acetaminophen is not as effective. But those are typically what we use in general for pain relief for COVID-19.
Great. So on the opposite end of that spectrum, what about avoiding any type of medication? Is there anything that people should make sure that they don't take if they have COVID-19?
Yeah, that's a really good question. As far as um, avoiding medication, there isn't, because of COVID itself, there is not necessarily a specific set of medications or what have you that you would need to avoid whenever it comes to COVID-19. Some people will say that you probably want to avoid using like nebulized medications such as albuterol around other people because of how easy that can make COVID spread. But you'd still be perfectly safe using the medication. It's just mostly about using it around other people. But typically, when we're talking about avoiding medications, there isn't anything that we're aware of that you should absolutely avoid, no matter who you are, if you contract COVID-19.
Perfect. So question 10, I got a little ahead of myself. You already answered this question. So we are going to supplement that with a question that some of our viewers asked. So
Mhm.
one of the questions that had come through was somebody who has already gotten vaccinated for COVID-19, are they good to go ahead and start caring for somebody else who has COVID?
So if you have been vaccinated, if you've had a complete vaccination, both doses of the COVID vaccine, and I believe that we typically recommend 7 to 14 days from the second dose to have maximum effect, then you're usually pretty safe to be able to care for someone who has COVID. meaning that the vaccine will ideally give you quite a bit more protection from severe illness due to COVID. You could still contract COVID even if you've been vaccinated, but you do have a little bit more protection. Of course, if you do, you'll still want to follow all the practices that we're doing now, making sure you and the affected person is wearing proper PPE, making sure that you're washing your hands frequently, things like that. But yeah, actually, with that, you do get some protection that will help. Of course, it's not 100%, nor is really anything when it comes to medicine, but it will help protect you. And as long as you're doing taking the proper precautions, then you probably have some level of safety.
Great. Let's answer one more question. This one was vaccine related too, so I think it fits. Just getting over COVID-19, and I was wondering if there is a waiting period before receiving the vaccine.
Right. So patients who have had COVID-19, so we typically would recommend that you would still get the COVID vaccine because we know that getting COVID doesn't necessarily protect you. We worry that it only protects you for a certain amount of time. So we still recommend that. As far as when you get the vaccine, there's some that recommend that you can wait up to 90 days after you have been diagnosed with COVID to get the vaccine, because we feel pretty comfortable or confident that you get some level of protection for that first 2 to 3 months after you've been infected. But if you wanted to get it sooner than that 90 days, you would be okay to do that.
Perfect. Thank you so much, Dr. AuBuchon. So now we're going to move on to question 11. Why might patients need help breathing if they have COVID-19?
Yeah, so if patients get severe illness due to COVID-19, it's usually due to a lot of inflammation happening in the lung tissue. And inflammation, while it's a good thing because it usually means your immune system is doing something, that inflammation in the lungs can cause a lot of problems. It can make it difficult for someone to take a breath or even take in oxygen. So if that's the case, if that illness is that severe, then it's very common that patients would need some supplemental oxygen, typically through a nasal cannula that you wear or some other device. And sometimes patients even need a pressurized mask. You might know these masks that are called CPAP or BiPAP. You might know those if you or a loved one has sleep apnea, but you may need that type of support so that it helps expand your lungs because the level of inflammation is making it difficult for your lungs to fully get to their full volume and be able to extract that oxygen from the air. So those are reasons why you would need some help with breathing for severe illness with COVID-19.
So, kind of along those lines, if somebody needs breathing treatments, what would cause somebody to actually be hospitalized for COVID-19?
Mhm. So if a patient um, does require that help. If you are having significant shortness of breath, you have low oxygen levels on room air, or if you have other things such as severe weakness, dehydration, or other complications due to COVID, or worsening of your chronic medical conditions due to COVID, those would all be reasons that someone would need to be hospitalized for COVID-19. And then with that, eh, you would probably need to stay in the hospital until that assistance that's being given to you has been reduced and it's something that's safe for you to be able to continue at home.
Perfect. Question 13 asks, should patients seek a specific provider once they get diagnosed with COVID-19 and they recover? Will they have long-term side effects from the coronavirus?
Right. So that's a good question too. So I strongly recommend patients to keep in touch with their primary care provider during and after diagnosis of this illness to make sure that there are no complications that pop up, that we keep a close eye on other medical conditions that you may have to make sure those are okay while you're recovering from COVID-19. They can also kind of help monitor for signs long term that patients might have longer effects from COVID, including fatigue, breathing issues, because unfortunately some patients will have long term side effects. We've heard in the media about something called long COVID, where patients have persistent symptoms like fatigue and breathing issues for weeks to months after getting COVID-19. but there's also some evidence to show that there can even be long-term issues with lungs and even heart disease that can be attributed to COVID-19. So all the more reason that you are staying in close contact with your primary care provider to make sure that we're keeping an eye out for that kind of thing so that we can monitor appropriately and do the testing that's necessary if we have concerns that there are long-term side effects.
Yeah, and I'm going to make a plug here. If people don't have a primary care provider, why is it so important for them to have one?
Well, when we're talking about COVID-19, I think it's really important to have a primary care provider because it is a point person that you can be able to reach out to if you have questions, if you have symptoms, you have concerns, so that you can get good advice on what to do. They can also help monitor if they know you and you've been seeing them for a while. Then they know you. They know what your baseline medical health is, so that way they can help gauge where you are when you're recovering so that way you can have another set of eyes to keep an eye on you to help make sure you get back to that normal baseline health as soon as possible.
Great. So we had a question come through whenever you were talking about breathing, the question previous, and I want to go ahead and ask it so we don't forget. So would a regular CPAP machine, forced air, not oxygen, would that be a way to help with breathing if somebody is struggling with COVID-19?
So it is something that we would do here in the hospital. We would kind of assess a patient and see what kind of difficulty they're having with breathing, being able to breathe, what your oxygen level is, and then whether or not you're able to get rid of expelled air easily. And if there's concerns with that, then sometimes we will treat patients with a continuous or what's considered a bi-level continuous positive airway pressure, but it's something that you would want to make sure is evaluated to see if that's actually what you need. So if you have CPAP or BiPAP at home, it's not something that we would typically recommend to use on yourself or other people if you're having symptoms. But just know that it is something that we will use in the hospital for certain patients that meet certain criteria.
Great. So question 14, how can patients know if they've reached a full recovery? You had talked about this before. Patients often get to day 12, day 14, and they lapse and they get much worse. What
Mhm.
is the process of that, and how do they know if they're actually sick or if they're well?
Well, it's really just kind of being in tune with your own body and knowing how you feel. Typically, most patients will return to their baseline health and feel fine relatively soon. But there are patients that have symptoms that last some time before improving, and even they can have a day or two where they feel really well, and then they kind of have a backslide basically where they feel tired again after that. So it can fluctuate, wax and wane the symptoms, but it's really you're looking for that sustained period of time where you're feeling really well, and then just recognizing that if you've had COVID and you're doing well, but then you're about a week or two out and you start having symptoms again, that there is that subset of patients that can have COVID-19 and do well, and then start to really struggle that far out. So um, there's not an exact way to know when you're completely out of the woods when it comes to COVID-19. It's all about making sure you're listening to your body and monitoring your symptoms and knowing um, that you shouldn't downplay symptoms that you develop later on after you think you've recovered from COVID, because it may be something that you would want your primary care provider to take a look at or talk with you about.
Great. So we have one more polling question, and then we're going to have some more participant questions. Let me go ahead and pull up that last polling question. Will you get the COVID-19 vaccine when it becomes available to you? I'll give everybody about 20 seconds to answer this question. And again, this is completely anonymous. Couple more seconds. And I'm going to go ahead and end that poll and share those results. So it looks like a majority of people said yes. We did have a few people who maybe wanted to know more information. So that's really great to know. If you have any questions, please go ahead and add those in the chat box. We're going to be answering some of those right now. So I'm going to go ahead and start with a vaccine question, Dr. AuBuchon. This one says, will the vaccine assure that you won't contact COVID-19 or contract COVID-19, or just reduce the chances of contracting the virus?
Yeah, so that's a good question. whenever the vaccine manufacturers were developing this and testing it, the primary goal was to see how well it reduced severe illness due to COVID. And that's where you get the numbers of like 95% or 90% effective. And so that means that the goal, or that the idea is that you would have that much more of a chance of not having severe COVID. um, we do know that you can still contract COVID if you've had the vaccine, just like you can get, if you think about getting a flu vaccine, if you get that, you can still get the flu. But the idea is that if you've had a vaccine, that your body has been basically trained and prepared to deal with that type of infection, and so your illness will be much less severe, ideally, than if you hadn't been vaccinated. But it's possible to catch COVID and it's possible to spread COVID, which is why it's important that in addition to getting the vaccine, we want to make sure that everyone continues to do the precautions that we've been doing with mask wearing, social distancing, and knowing that all that together will help us get this under control a lot faster.
Fantastic. Great answer. One of the other questions that we had come through said, along with water, what drinks could help a patient hydrate and replenish minerals and vitamins in their body?
Sure. So we always say hydrate, and a lot of people think, water, and water is good, but it is good to make sure that you're getting more than just water when you're hydrating. So I'm a big fan of drinks that have electrolytes in them. So I'm thinking over the counter Gatorade, Powerade, or even ones that we typically use for kids like Pedialyte. There's no rule that says an adult can't have Pedialyte. But of course, you want to make sure that you're drinking um, uh, uh, an electrolyte filled drink that's okay with you, especially if you have something like diabetes, because some of those will have sugar in them. But typically, those types of drinks will be good. Some people will drink soda and things like that, and if that's all that you can really tolerate because you're having nausea, then that's okay to have some. But really, the best is going to be those electrolyte filled drinks where they kind of taste sweet and salty at the same time.
Great. We have one more question come through. Can you care for somebody who has COVID outside of your home? Is that safe, or should you wait until you have the vaccine?
Well, going back to the question that was asked earlier, I think that you would want to do whatever you could to protect yourself from contracting COVID and getting severe illness as best you can, as quick as you can. And so the best protection would be being able to have the vaccine and have the proper protective equipment. We take care of patients in the hospital every day with COVID, and typically it involves wearing masks, goggles, gowns, the whole nine yards. So if you are knowingly taking care of a patient who has COVID, you would really want to make sure you take every precaution you can to protect yourself, um, to help reduce your risk of getting severe illness.
I think that's great. Great answer. So that's actually it for today. I think we're going to wrap up a little bit early. So thank you so much to everyone for tuning into the Scope at Lunch. A huge thank you to Dr. AuBuchon for sharing his knowledge today. We appreciate all of the insight that you've been able to share with our community and everybody who joined us. As a reminder, this show has been recorded and will be emailed to all participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you liked this show and would like to know more, check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great rest of your day, everyone. Thank you so much for joining us. Thanks.